Very good afternoon, all of you. We'll start for today's CME. On behalf of MAASD organization, that is Maharashtra Association of Ayurveda Students and Doctors, I, myself, Dr. Rashmi Doifude, as a MAASD coordinator from Thane, Mumbai, would like to extend a very warm welcome to all of you for attending today's 99th clinical meeting. Today's CME topic is Ayurvedic management of psoriasis by an Panchabhautik clinical approach. It's indeed a pleasure to welcome our esteemed guest speaker, Honorable Vaidya Aniruddha Kulkarni sir, MD Ayurveda, a renowned Panchabhautik clinician from Sangali, Maharashtra. Widely respected for his clinical, case-based Panchabhautik clinical approach. We also extend a warm greeting to the MAASD leadership. Dr. Ramdas Garje sir, the founder and president of MAASD. Welcome you, sir. Dr. Sujit Dundle sir, secretary of MAASD. Dr. Nitin Patil sir, coordinator of MAASD. And Dr. Seema Garje ma'am, the conveyor of MAASD, also the better half of the founder. I request all of you to please keep your mind mute, stay calm, and stay oriented this program. Along with all our leadership of the MAASD, I also like to invite and give a thanks to regional and city coordinator and all our respected delegates joining from across the India. Very good afternoon, all of you. We'll move further. As per the sacred tradition of every Ayurvedic program, let us begin by seeking the blessing of Lord Dhanvantari, the divine physician. I request all of you to please stay calm, keep your app or mobile on mute, close your eyes, keep your mic mute, stay tuned with the program. Dr. Anjali, keep your mic mute. We need to move forward with this program. I request all of you to keep your mic mute so that we can move forward and take the blessing of our Dhanvantari, Lord Dhanvantari. I like to proceed with a shlok. नमो भगवते धन्वंतरे अमृत कलशाय हस्ताय सर्वामहे विनाशनाशाय त्रैलोक्य नाथाय श्री महावैष्णवे नमः. I request Dr. Harshal Kauthalkar sir, the PG coordinator from Navi Mumbai, MAASD, to lead us with the Dhanvantari Stavan. Dr. Harshal, you can talk further. Dr. Harshal, you're able to listen to me?
मॅडम तुम्ही क्या करून स्क्रीनवरून मीटिंग मध्ये नाहीये तो.
Okay. I request all of you to please keep your mic mute. Keep your eyes closed, stay calm, join your hands. We'll start with the Dhanvantari Stavan. Shankam Chakram Jaloka Dadamita Ghatam Charu Hindam Sukshma Sraksha Virvinadam Shuka Parivilisakam Abhibhojanadram Kala Jarangan Kativalisthitam Vikrantanalam Andye Dhanvantarindam Nikhiladadattam, Prodatavan Nilingam, Prodatavan Nilingam. We'll further move with the program and would like to highlight you about the MAASD is not merely an organization, but a growing academic movement dedicated to strengthening the Ayurvedic education and the clinical excellence. To explain the concept, the vision, and the academic foundation of the MAASD, I like to invite Dr. Ambika Shukla ma'am, the city coordinator from Maharashtra, Mumbai. Dr. Ambika Shukla,
Yes, ma'am. Hello.
please talk further.
Hello.
Keep your mic.
Am I audible?
You're audible, ma'am. Keep your video on.
Am I audible, ma'am?
Yes, ma'am. You're audible.
Yes. I would like. Hello.
Yes, ma'am. Dr. Ambika, ma'am.
Yes. Just a second. Maharashtra Association of Ayurveda Students and Doctors, respected Vaidyas, teachers, students, and colleagues. For more than 16 years, Maharashtra Ayurveda has stood firmly for the rights, sovereignty, and professional dignity of Ayurveda doctors and students across the country. What began in 2008 as a collective voice has today grown into nationwide volunteer-driven movement committed to stabilizing Ayurveda as a scientific, ethical, and socially responsible medical system. MAASD is a non-political, non-commercial NGO registered under the Mumbai Public Trust Act and recognized by Niti Aayog Darpan with CSR 80G and 12A certification. But beyond registration and certificate, MAASD is a mission powered by people, by doctors, teachers, and students who truly believe in the future of Ayurveda. Our vision is clear: to unite Ayurveda students and doctors, protect our professional rights and sovereignty, promote ethical practice, education, and research, and serve society through Ayurveda-based healthcare. MAASD actively works in Ayurveda advocacy, medical education, and CME, public awareness, community health activities, and cultural and medicinal plant conservation. Today, MAASD, as we know, stand as one of the strongest and most followed voices of Ayurveda. And we should feel lucky that we are part of it, and connecting practitioners, academicians, institutions, hospitals, and the pharmaceutical ecosystem across India. Friends, Ayurveda cannot move forward in isolation. We all have to come together. Its strength lies in the unity. Its future depends on collective action. Ayurveda does not need sympathy, it needs unity. Ayurveda does not need slogans alone, it needs committed doctors. Ayurveda does not need silence, it needs a strong collective voice. When injustice arises, MAASD stands. When societies needs healing, MAASD serves. When education, research, and professional rights are challenged, MAASD takes leads. This is our time. This is our responsibility. This is our Ayurveda. One doctor, one student, one voice, one movement. Come together, join MAASD. Strength Ayurveda, secure the future. Let us stand together. Let us rise together. Let us make Ayurveda sovereign together. MAASD, where Ayurveda stands united. Thank you so much. Thank you, MAASD, to give me this opportunity.
Thank you, Dr. Ambika Shukla, ma'am. I will further like to share the aims, objectives, and the future academic direction of the MAASD. I would like to invite Dr. Abhilasha Parade, ma'am, from Mumbai, Sub-Regional Coordinator of MAASD, to talk further.
Good afternoon, everyone. Myself, Dr. Abhilasha Parade, working as a coordinator Mumbai Western Suburban. You all are excited to learn the deep knowledge of Ayurveda from respected Vaidya Kulkarni sir. So, not taking much time, I will briefly introduce about Ayurveda aims and objective. Ayurveda organization to unite all Ayurvedic students and doctors to unite all Ayurvedic students and doctors into a strong, inclusive, and globally connected Ayurvedic organization in coordination with other associations. Second one is sovereignty of Ayurveda professionals to establish equal or supervisor recognition, authority, and dignity of Ayurvedic doctors across all healthcare and administrative sectors. The third one is medical education to strengthen Ayurvedic medical education through integrated learning, academic dialogues, and continuous skill development. The fourth one is research to promote, support, and disseminate quality research in Ayurveda for benefits of students and practitioners. The fifth aim of MAAS is social responsibilities to provide ethical, accessible healthcare to unserved communities and during disasters while promoting preventive Ayurvedic health practices. The next aim of Ayurveda cultural activities preserve and promote cultural heritage and organizational unity through meaningful cultural programs and celebrations. The next one, the promotion of Ayurveda to propagate the scientific principles, values, and global relevance of Ayurveda for universal health and well-being. Next one, cooperation and industry to encourage entrepreneurships and cooperative ventures in Ayurveda, including hospitals, pharmaceuticals, and Panchakarma services. Next one, Ayurvedic medicinal plant conservation to conserve and promote medicinal plant through coordinated efforts among farmers, industry, researchers, and government bodies. And the last one, nationalism to contribute selflessly to national progress through Ayurvedic services while upholding strong Indian national values. Thank you very much.
Thank you, Abhilasha, ma'am. We will like to go further and provide further information and a very important information regarding the mass registration, the CME guidelines. I would like to invite Dr. Sharvari Deshange, ma'am, working as a city coordinator from Khargar, Panvel, Navi Mumbai. Dr. Sharvari, ma'am.
Yeah, thank you, ma'am. Good afternoon, everyone. Let's see how important to register with MAASD membership. MAASD membership empowers Ayurvedic students and doctors with professional growth, clinical exposure, and national level recognition. It connects you to a strong academic, clinical, and professional Ayurveda network across India and beyond. So let's see your key benefits. Professional growth and clinical learning. You will receive participation in a MAASD CMEs, seminars, conferences, and academic programs, and also opportunities to present clinical cases and speak at scientific forum. Next, networking and professional visibility. You will easily connect with Ayurveda students, practitioners, academicians, and experts. And also listing in a MAASD Ayurvedic practitioner directory for enhanced visibility. There will be a MAASD website for a practitioner portal. So you can easily get opportunity for online consultation through MAASD platform. Next, practice support and knowledge sharing. You will get a clinical guidance and expert opinion for day-to-day practice. Also get a platform to share case studies, research work, articles, and experiences. Next, recognition and active engagement. You will receive official MAASD professional membership certificate and opportunity to volunteer and actively participate in MAASD initiatives like free Ayurvedic health camp, Wari camp, Ruksharopan, and many more. So special benefits for students. PG scholars, and young doctors, career guidance, mentorship, and academic direction. Get early access to job openings, internships, assistantships, and practice opportunities. You will get details on MAASD WhatsApp group. Then last, MAASD membership checklist. How you can apply for it. Fill and submit the MAASD membership Google form. Membership fee validity for 5 years. From the date of membership. So professional benefits, 50% discount on all online and offline CME or clinical meetings. Let's see in the details. There will be a 100 rupees discount on 200 registration fees. There will be 4 CMEs in a month, and in 5 years, approximately 240 CMEs. So that you will get approximately 20,000 discount. Next is a 10% discount on national and international conferences. Priority seat reservation for major conferences. Early access and priority registration for CMEs and workshops. Opportunity to present clinical cases on MAASD platforms. So the free fees will be UG students and internees 1199 and and any doctors 2999. Please note, this is an introductory registration fee and may be revised based on the organizational and national financial conditions. So please be a part of a voice that shapes Ayurveda. MAASD membership empowers your growth, practice, and identity. Jimas, thank you.
Thank you, Dr. Sharwari ma'am. I would like to move forward and introduce for today's eminent speaker, Dr. Aniruddha Kulkarni sir. I would like to invite Dr. Tejas Pipalgaonkar sir, working as a PG coordinator from Navi Mumbai, to introduce our honorable speaker. Dr. Tejas.
Yes, thank you so much, ma'am. I would like to introduce to our today's speaker, Vaidya Dr. Aniruddha Kulkarni sir is an highly respected and seasoned Ayurveda practitioner. Sir has a vast clinical knowledge and deep interest in Panchabhautik Chikitsa and Panchakarma Chikitsa. Also, sir is among the few fortunate disciples of the legendary late Vaidyaraj Dattar Shastri sir, carrying forward an authentic Guru Shishya tradition. So what about clinical physiology? So sir has an 25 years of dedicated clinical practice. Sir solely focuses on understanding the disease process within the patient rather merely than reacting to the external symptoms. His belief is simple yet powerful. Correct the basic body activities and healing happens naturally. So he is not only a practitioner but a teacher who creates interest, which awakens curiosity and clarity. As Ayurveda is an applied science, he beautifully blends in strong theoretical foundation, rich clinical exposure, modern scientific perspectives. Sir has been conferred Ayurvedacharya MD in 1990. Also, Sir has completed advanced training under Brihatrey Ratna Vaidyaraj Atmaram Vaman Datta Shastri. Also, Sir has completed advanced training in National Training Program in Panchakarma 1997. Clinical experience. Sir has a clinical experience and has been practicing Panchabhautik Chikitsa, Panchakarma Chikitsa and family healthcare at Sri Atmaraj Ayurveda Chikitsalaya Miraj since 1992. Also, Sir has published many books, among which are Pancha Mahabhautik Chikitsa Volume 1, Visha Aushadhi Kalpa, Sharir Kriya Vignan, that is textbook of Ayurvedic physiology, and Arogyaksha Ayurveda. Not only that, Sir has also contributed in academically. Sir has published over 350 articles, given 160 plus lectures, conducted 15 seminars, and has 12 research papers. Also has conducted television interviews on health and Ayurveda. Professional association. Sir has Vaidya Dattar Panchabhatik Chikitsa and Samshodhan Kendra in Sangali. Also association in Rugna Seva Prakalpa Miraj. General Practitioner Association of Miraj and the Miraj Education Society Rotary Club of Miraj. The honors and leadership roles which are given to Sir are government council members, which is given by Annasau Dange Ayurved College Ashta, Editor-in-Chief Nirmay Arogya Patrika, Co-Chairman Chikitsa Session Panchabhotikam 99. Also, Sir has been given awards, various awards, among which are Ayurvedia Araksha Limited Satara Lokaguru Best Book Award, Panchabhutik Ratna Award. Dr. Aniruddha Kulkarni sir truly represents the soul of the Ayurveda, rooted in his tradition, redefined by practice and relevant to modern times.
किती बोलतोय हा
Thank you, Dr. Tejas Hepalkar, sir. I request you all to keep your mic mute. We'd like to proceed to the core academic session. The topic for today is a clinical case presentation and discussion of Ayurvedic management of psoriasis, a Panchabhautik clinical approach. With great respect, I request our esteemed guest speaker, Honorable Vaidya Aniruddha Kulkarni, sir, to kindly begin today's lecture. Sir, the virtual platform is yours. I request all of you to kindly keep your mic mute.
Good afternoon, everyone, and thank you very much for inviting me for this 99th CME of MAASD. And it's my pleasure to present my thoughts on the management of psoriasis with a special consideration from Panchabhautik chikitsa. So let me share my screen and let's start with my screen. I will share with you and present. Okay, so all of you can see my screen and hear my voice. Yes. Yes. Okay. So let's start. So before commencing, let me pray to Bhagwan Dhanvantari, Sadguru Sant Kula Shiromani, Sri Jnaneshwar Mauli, and my Guru, Vaidyaraj Bharatre Ratna, Atmaram Mohammed Datar Shastri, the pioneer of Panchabhautik Chikitsa. So let's start. So when we say that this psoriasis and what the psoriasis means, that it is basically a inflammatory and proliferative disorder of the skin, which clinically manifested as circumcised erythematous papules and plaques covered with scales, typically located over the extensor surfaces and scalp. So it is a Hello? Yes. Can you hear?
Yes, yours. Yes, sir.
Yes. So everyone knows that psoriasis is a chronic inflammatory disorder with erythematous papules and silvery scales, and it is a very one of the most chronic and clinically very tough disease to treat. You, as a Ayurveda physician, many times get psoriasis patients, and they come to us with lot of hope that Ayurveda, being a science which can be useful in treating the chronic disorders and incurable disorders, labeled incurable as the modern medicine or modern science, medical science. But yes, the psoriasis in patients, we can do so many things. Sometimes we can cure them. Sometimes we can reduce the severity of the symptoms. But we have to remember and always, educate and aware our patients that this is a very tough disease to treat. It can reoccur, it can relapse. And the main point is, after treating the disease, when the patient is getting some relief, he should follow strict diet and behavioral changes and come to Ayurveda, come to you or come to Ayurveda when some in primary stages, in early stage of the disease, if patient comes to you, it is very much easy to treat. Now, Panchabautik Chikitsa, pioneered by late Vaidya Datar Shastriji, views pathogenesis through the lens of Mahabhuta dominance. Now, Panchabautik Chikitsa is pioneered by Datar Shastriji, but it is not a kind of people. So many people think that it is something which Datar Shastri has from his own thinking he has developed. Yes, he has developed the different approach of looking at the Ayurveda, looking at the physiology, pathology, medicines. But all the base of Panchavati Chikitsa is Ayurveda and Ayurveda Sanhitas. So, Panchamahabhutas, which are the part and parcel of the nature and our human body, they are everywhere. They are the basic functional and structural units of universe and human body. So, when you think of Mahabhutas, it is one step further, it is one step further down or further subtle, that is Sukshma level, than Tridosha. So, because Tridoshas are formed from Mahabhutas, Vaivakash Dhatubhyam Vayuhu, Agneyam Pittam, Prithvi Ambabhyam Shleshmaha. So, Ayurveda also tells that the Tridoshas are formed from Panchamahabhutas. So, the concept of Mahabhuta is very much important. It offers an effective Ayurvedic approach where allopathic management may be unsatisfactory. So, after that, we have to look for the allopathic management where the patient is not satisfactory. Now, core theory of Panchabhotik concepts is that disease arises from abnormalities of the properties of the five Mahabhutas within the body. So, five Mahabhutas and properties. Now, these properties basically and specifically the properties which are useful for the understanding of the disease and treatment modalities are the Gurvadi Gunas, the 20 Gunas which are the opposite properties of each other, that is Guru, Laghu, Sukshma, Sthula, and all these things. So, these 20 Gunas are most important for our treatment thinking. Now, what Guruji used to say that Sagli Chikitsa Gunanchis Aste. All the treatment is nothing but the equilibrium of the gunas, the properties. So, the properties are most important. So, the etiological factors which are mostly important in cases of psoriasis or kushtha are some dietary factors such as excessive intake of contradictory, that is viruddha ahar, which is hard to digest, guru ahar, oily food, snigdha, ati snigdha ahar, milk with meat or fish, excessive curds and salt. Now, all these things, they contribute in the making of pathology of psoriasis. In behavioral factors, the suppression of natural urges, Vegavadharan, sleeping during the day, that is Divaswap, bathing in cold water immediately after sun exposure, that is the Shita Ushna, the Shita Ushna Vyatyas, which is written in the Vyatyas, what we say, that doing the opposite thing exactly after one thing. So this is Vyatyas. So this is all been the causes of the Kushtha, and especially the psoriasis, like the Kushtha, which is primarily a Kapha Vata Pradhan Kushtha. It is a Chirakari Kushtha. It is a chronic in nature, and there are some psychological and karmic, the causative backgrounds also noted. That is transgressing hygienic rule, that is Sadavritta Palan Na Karna, and mental stress, with different kind of mental stress and grief, anger. There are so many factors which affect our mind, and mind is closely related to the sense organs. Basically, the indriyas are 11. We know that 5 jnanendriyas, 5 karmendriyas, and 1 mind, which is a ubhayatmaka indriya. So the sense organs, that is Shabda Sparsha Rupa Rasa Gandha Tanmatra and Shabda Sparsha Rupa Rasa Gandha, which are percepted by their respective organs, indriya, jnanendriya, that is the Rupa is percepted by the Netrendriya. The Shabda is associated with Shrotrendriya. The Sparsha is associated with the Tvacha. So this kind of the Indriya related causes, and their man is also there. The mind is also important. So many times in not only in psoriasis, but in all kind of skin diseases, the concept of mental stress is highly considered in modern medicine also, because many patients you can see, if they went in mental stress for a longer period, they may suffer some kind of skin disorders or allergic disorders in coming months. So it's also very the hetu is very important. Now the primary trigger is often ahar rasa abnormality due to impaired digestion. So the pachana, the sara kitta vibhajana, the poshana, all these things, the activities of the Agni, the activities of the Jatharagni, Bhutagni, Dhatwagni, the state of Rasa Rakta Dhatu, their portion, Dhatu portion, we see the Dhatu portion, Nyaya are there. There are 3 or 4 Nyaya for Dhatu portion. So all these factors, all these pathological pathways, they contribute in the diseases of the skin. Now the main thing is this abnormal ahar rasa, it initiates putrefaction in regions of similar Mahabhuta properties. See, when the ahar rasa is inflicted, ahar rasa is dushta with the gunas which are similar to the Mahabhuta properties. That is when there is a ruksha shita. If ahar ras is ruksha shita, it will definitely affect Vayu Mahabhut. If ahar ras is ushna, it affects Tej Mahabhut. If ahar ras is sukshma vishada, vitiated with Sukshma Vishada properties, it will affect Akash Mahabhut properties. So these kind of things are there. So in Prithvi and up, they are predominant in lower limbs, and that leads to thick, rough itching patches with potential oozing. Now, most of the times in psoriasis, the patches are dry in most of the patients. Only the scales will come out. Scales will come out, but hardly there are complaints of oozing, or there is secretions, or there is bleeding. So in many, I have not seen so many patients of oozing or bleeding, but mostly it is a dry kind of kushtha. Teja causes eruptions in the abdomen and back regions. So the where the psoriasis started, that is the main question we ask in Panchavatik Chikitsa, or you should also ask where was the first lesion. And the first lesion, according to the eruption of the first lesion, you can decide the affected Mahabhuta region wise. Vayu Akash, they are dominant in head and skull, and that's why mostly there are dry lesions and cracks. The Teja, that is Teja Mahabhuta lesions, they can erupt around abdomen and back regions. So the main thing is that the first thing is where the first patch appeared. Now that is also the important part. Now dosha dusha sangraha. When we study any disease in Ayurveda, we look for the dosha dusha sangraha. Which is the initiating dosha, and what are the associated doshas, and then after the doshas are vitiated, when the doshas get prakupita, to which dushyas they affect, which dhatus and malas and srotasas they affect, they are called dushya. So dosha dushya sangraha is important for each and every disease. So in psoriasis, all three doshas are associated, and mainly the kapha dosha is main initiating dosha, kapha, vata, pitta, and many times you can see the involvement of the rakta also. And in dushas, rakta, tvacha, lasika, so all these dosha dushas, they are involved in psoriasis patients. Now, as I say, that this is a chronic patient, the chronic disease condition, and mostly related to, and it erupts on the skin, mainly visible on the skin. So it has a parallel kind of considerations of prameha and kushtha, and many times the prameha and kushtha also they can be seen at the same time simultaneously in patients, because the prameha and kushtha, they share many things in common, and but in prameha, the samprapti goes like bahu drava shleshma dosha vishesha. So the kapha, when it's vitiated majority with drava property, the pathology goes to prameha. And the shleshma, when gets afflicted with the parthiva properties, that is the sthula and all these things, sthula, guru properties, the pathology moves to the kushtha or psoriasis. So this kind of understanding can be only get this kind of understanding if we study Panchabhotik Chikitsa or we adopt Panchabhotik approach. Then we get the clear understanding of the disease process, the pathogenesis, how the disease has progressed. Now the triad of Agni Samstha. Now this is the main that is concept of Agni Samstha. Now Agni Samstha is considered in around the Nabhi region, that is abdominal region. Nabhi Grahani is the place of Agni. The main location of Teja Mahabhut or Jathar Agni is Grahani, and that is around Nabhi. So when we say that Kaya Chikitsa iti Agni Chikitsa, we have to understand that unless and until we can examine and assess the status of Agni, we cannot plan our treatment. So how to examine the Agni? The main next question is how to examine the Agni. Now how to examine means in Ayurveda we can examine or examination of Agni can be done in two ways. One is how much time Agni takes to digest the food. If it digests food quickly, it is a Tivragni, which is related to the Pitta dosha. If it takes time to digest, it is a Mandagni, related to Kapha. And many times you cannot predict the Vishama. You cannot predict. Sometimes that food will be digested early. Sometimes that food will be digested after a long time. That is a Vishamagni, which is related to Vata dosha. So this is the one type of Agni examination. The second type of Agni examination is as mentioned by Acharya Charak in Sharir Sthan. It is based on Apachara Sahatva. Apachara Sahatva. That is how your Agni can adapt or deal with apachar. If you eat some unwholesome, viruddha or asatmya ahar, how your Agni reacts, how your Agni can adapt and how it can digest your that ahar, that food which is not used to you, or it is very different from what you are used to eating. So this is called as apachara sahatva. You can check in Sharisan. That is also the examination of Agni. Now the problem with these both systems or both types of examination is that they are very subjective. That is, they depend on entire understanding and what the patient says, what patient feels. They are entirely dependent on that. So Datar Shastri developed this Yakrut Pliha and Mutrapinda concept of Agni Samstha by considering the Pachana Vyapar, that is Bharan Poshana Utsarjan, ingestion, assimilation, excretion. We say that metabolism, metabolism is how the nutrients come, they are digested and they are excreted. So this is the Pachana Vyapar, the word used by the Atar Shastri. And these are the three avyavas, three organs, three regions of organs, I should say. That is actually, we are not examining Yakrut, liver word-wise. We are examining in the hepatic region, in the splenic region, and in the urinary system region, that is below umbilical region. So, Udara Pariksha, which is very important in Panchavhatik Chikitsa, is done on this abdominal part. Liver, it often exhibits pain on deep palpation, and that efficiency must be restored. Spleen acts as a storage for blood metabolism waste, may show stony dullness on percussion. In Udar Parikshan, in Panchavhatik Chikitsa, there are 4 kind of tests we perform. One is Mrudu Kathinyatva. The second is the Ushna Shitatva. The third is Pidana Satva. And fourth is Shabda Pariksha or Nada Pariksha, that is percussion. So, on percussion, we can get different kind of notes. That is from stony dullness to tympanic notes we can get. And the stony dullness or dull notes, they denote Prithvi and Ap Mahabhuta dominance. While as you go on holy or empty notes, that is tympanic notes, you go to Agni, Vayu and Akash. So that is a different part you can learn, and you can practice the Udar Parikshan, and you will get the knowledge of how it is useful in diagnosing and treating patients. Urinary system, tenderness in renal areas indicates that the need for specific toxin excretion. And we use Shwadhanstade Google for that. Now, involvement of dhatus and symptoms. When you analyze any disease which is modern in nature, modern in name, and when you have to understand it by Ayurvedic perspective, what we can do is that we can analyze or write down the symptoms, the pathology, the complications, and we can correlate them with dosha dhatu mala vitiated symptoms. And in case of psoriasis especially, which dhatu shows which symptom which is related to the psoriasis, like numbness, roughness and slight itching, we can understand or correlate it with rasadushti. Itching, pus or foul odor, we can flag it to the rakta dhatu. Thick patches, hardness, pricking pain, these symptoms if are there, we should consider the involvement of Mausa dhatu more. Increase in waste products and parasites. If there are krumis, if there are some parasites, if there is some secondary infection, secondary inflammation, we should always look for the concept of krumi. Prodromal signs, that is Purva Rupa, roughness, itching, numbness, absence of sweating. So all these Rasarakta Mausa Meda, the main 4 dhatus are involved, and you can see many symptoms which are associated with these vitiated dhatus that can be seen in psoriasis. Now treatment. treatment part, how we can think about treating the psoriasis patients. Now, determination and removal of causative factors, Nidana Parivarjan. It is the main part, because we have seen earlier that there are many patients with the different kind of hetu sevana, the different kind of causative factors, causative backgrounds they approach us. We can, when we interrogate them, when we see them, that is darshana sparshana prashna pariksha, when we conduct on the patients, we can find so many causes, so many different kind of causes we can relate, that yes, this cause, this factor can lead to psoriasis. So we should write down all the causative factors which we think that they are involved or they are related to the psoriasis. So we should ask the patient to stop the congestion of the causative factors through the pathya concept. Correction of the digestion process, that is Agni Dipana. That is why, because there is a predominance of Prithvi, there is a predominance of the Prithvi and Ap Mahabhuta. There is kind of Ama, there is Viruddhahar, there is a chronicity, there are thick patches. So all indicates to the Agni Mandya, or that's why we should be doing Agni Deepana alongside the Agni Mandya, which we have to consider. So digestion of Am Pachana is also very important, because Am is mostly produced from the vitiated Prithvi and Ap Mahabhutas. So Am Pachana, Am Nirharana is the main part of treatment. Metabolic toxin digestion and Krumi management. Metabolic toxins, that is the Vishakari Ghataka, the toxic substances which are formed due to the Viruddha Ahar, and concept of Krumi. In every Kushtha, maybe it may be dry or wet, we should always consider Krumi factor in it. In every Kushtha, the Krumi factor should be considered and treated. Though we cannot find direct Krumis anywhere, because see, the Krumi concept is mainly involved with the Kleda, and Kleda which is stagnated, एक जगह पे जमा हुआ, एक जगह पे बैठा हुआ क्लेद. Now that clade which is not moving, that is which cannot be excreted and which cannot be dried, it can create many kind of diseases, many kind of disease conditions, and one of which, the first thing, if the clade is stagnated, the genesis of the Krumis is there. So in every Kushtha, and especially in the psoriasis, the concept of Krumi and its chikitsa is primary and primordial and important for that. And then nourishment of dhatus when pathogenesis is broken. See, when Samprapti Bhanga is done and Agni Deepan is done, Am is dried, Srotasas are open, and there is the dhatu nourishment should be there. Dhatu nourishment should be considered. Now, the treatment part of psoriasis should involve the Shodhana and Shamana chikitsa. In part of Shodhana, that is mostly the classical procedures which we can do or they are proved efficient are the Vamana, Virechana and Raktamokshana, which can be done. Because as we see that the Vamana, which is highly recommended for the expulsion of kapha dosh, is also important for these psoriasis patients. Raktamokshana. I generally do the Sarvadahik Raktamokshana every 1 month, for 3 months in all psoriasis patients. महीने में एक बार रक्त मोक्षण पेशेंट का सार्वदैहिक यानी सिरा वेद करके मैं जरूर करता हूं. Vamana and Virechana can be also be done. They are useful. But what I generally do is, I generally do Vamana or Virechana in psoriasis patients in their respected Rutu Shodhana Kal. That is, in Vasanta Rutu, go for Vamana. If the patient arrives at us in say in Shishir Rutu, or if one patient comes to us in now this February month, this month of psoriasis, what I advise him that we will start the internal medicines and the Rakta Mokshana, but we will do your Vamana in the Chaitra Vaishakh Vasant Rutu month. So you come after Gudi Padwa and we will do the Vamana. Like this Virechana also in Sharada Rutu. It is in the kind of October heat. Specifically, what I tell my patients that of this Rakta Pitta Dushti patients of Virechana and Rakta Mokshana, when I ask them to do, mostly after Dashara, you come at Dashera, that is from Dashara to Diwali. In between the 3 weeks are there, and in these 3 weeks, I always ask my patients to come for Virechana and Rakta Mokshana. But in psoriasis patients, I always do once in a month for 3 months. So, and they really are helpful and they are useful because they expel the majority of the doshas in one go. That is the most important part of Shodhana Chikitsa. But we have to do proper Snehana Svedana and then go for the woman. Now, subtle purification, that is a hallmark of Panchabhutik Chikitsa, which is focused on restoring Yakrut Pliha Mutrapinda functions. Now, that is we call the Sukshma Shodhana. Sukshma Shodhana. That is a daily Shodhana, and you always go for the equilibrium, maintaining and establishing or restoring equilibrium of those dhatu mala. See, dhatu samya kriyaschokta tantrasyasya prayojanam. Now, when we say that we are treating any disease, we should not be treating that disease always. What we are actually doing is, and what we should focus on doing is that dhatu samya kriyaschokta. Now the kriya, that is the chikitsa, the modalities of the treatment we are using, the shodhana, shamana, it should bring the dhatu samya. It should correct the dhatu vaishamya, which has a lead to the generation of the disease. That's why dhatu samya kriya shukta tantra sasya prayojanam, dhatu samya लाना ये हमारा चिकित्सा का उद्देश्य होना चाहिए, ना कि हमें कोई डिसीज को ट्रीट करना है. So if we focus on this Panchavati chikitsa helps us lot in the baseline purification of the dosha dhatu mala. Takra dhara, it is one of the dhara parishek, the svedana, the types of svedana. The takra dhara is particularly effective in scalp psoriasis. When the psoriasis is major, if it has arise from scalp or it has in other places of the body also, the takra dhara is definitely useful. Now the internal medicine. So the shodhana first is vamana, virechan, raktamoksha, takra dhara, and the panchabhotik concept of subtle purification, sukshma shodhana, that should also be practiced, that should also be always considered while treatment. In internal medicines, the most important is arogya vardhini. Arogya vardhini in Panchavati chikitsa, arogya vardhini is prepared with the kutaki, which is processed 7 times with its decoction. The sapta bhavita kutki, कुटकी के काढ़े की 7 भावना दी हुई जो कुटकी है, उस कुटकी से बनी जो आरोग्यवर्धिनी है, उसका इस्तेमाल हम पांचभौतिक चिकित्सा में करते हैं, ऐसा दातर शास्त्री ने कहा है. So you potentize the kutki 7 times, and in Arogyavardhini the proportion of kutki is 50%. So the kutki is the main role, which is cleansing. The most important is cleansing the yakruta, cleansing the yakruta, that is from where the Agni Deepana will be there, Avrodha will be Avrodh, the obstruction will be eliminated by the kutki. So the Arogyavardhini is important. It focuses on liver efficacy and dhatu nourishment. See, Arogyavardhini, which is potentized by the 7 times bhavita kutki, it also contains many bhasmas, many dhatu bhasmas like abrak bhasma and all these things. So what Datar Shastri used to advise, that in liver disorders or wherever you are treating the yakruta, don't start with Arogyavardhini. Don't start with Arogyavardhini, because Arogyavardhini has so many ingredients which are the Vyavai, Vikasi, Sukshma, Vishada. They can go to that level because of bhasmas and all these things. It should be used for dhatu pachana. That is when clinically how to define this condition. When any patient tells you that his mala mutra pravrutti is normalized, is okay, his hunger is okay, then only you can start with the Arogyavardhini. Before that, our main medicine is Phalatrikadi Gugul or Phalatrikadi Kadha or Phalatrikadi Arishta, depending on the condition of the patient and dosh dhatu involvement. Phalatrikadi Gugul is a primary digestive or excretory drug to ignite Jatharagni and Dhatuagni. So Phalatrikadi is the fantastic formulation, and it is our first medicine for the liver disorders. Then Patoladi Yoga or Rakta Pachak, Patolam Sariva Mustha Pata Katuka Rohini. It acts as a digestive, that is pachana of Rakta Dhatu, and it helps in purification of the blood impurities and also slowing down the pace of hyperkeratosis. See, आप जैसा देखते हैं कि in psoriasis there are layers and layers of the skin which go up and above each other, and that's why the patches form, and then like the scales, they go down. So the hyperkeratosis, it definitely comes down with the use of Patoladi Yoga. Then there is a Chaturthak Yoga. Chaturthak Kiratikta Amruta Chandanam Vishwabheshajam, that is Medo Pachak. It helps in controlling itching and scaling of the lesions. It helps, and it provides stability to the skin and also pacifies the vitiated Vata dosha, which is aggravated due to obstruction and the Vayu Mahabhuta. The other main action of Chaturthak Yoga is that it is useful in Krumi Nirharan, Krumigna. It has a Krumigna action, and that's why in every skin disease this should be used. Shvadanstradi Gugul. Shvadanstradi Gugul is Gokshuradi Gugul potentiated by the decoction of Gokru, Dhamasa and Pashan Bhed. This is the Patha Bhed done by Datar Shastri. That is Gokshuradi Gugul, the main recipe or the main part of Gokshuradi Gugul. And then we add the Bhavana of Gokru, Dhamasa and Pashan Bhed. Now, its main action is excretion of toxins via urinary system. Mutrasya kleda vahanat, Svedasya kleda vidruti. So the kleda is associated with the mutra, sveda, it is dravata, and kleda is something which is a dravata with toxins. So you have to either digest that toxins and dravata, or you have to expel it out, and that's why Shvadanstradi Gugul is most important. Tamra Bhasma, it used for mild liver obstruction, because Tamra it has a property and action of Lagu Lekhanam, that is, it can reduce the skin thickness, scraping, lekhan, it can do lekhana. So Tamravasma can be also used. Jwarahara Yoga, that is combination of Tribhuvan Kirti and Suvarnagari to digest Rasarakta toxins. When you see any Rasarakta toxins which are leading to especially the skin diseases, the Jwarahara Yoga is important. Tribhuvan Kirti with Rasa Sindur. In place of Hingul, you go for Rasa Sindur. Rasa Sindur is a Kupi Pakwa Rasayan, and it has Vyavahi, Vikashi, and Sukshma properties embedded in it. And that's why Rasa Sindur, why it is important? Because it increases potency and penetration of the drug. It helps in bioavailability of the ingredients of the other ingredients of Tribhuvan Kirti. It acts as a vehicle. It can lead the other medicinal drugs to the point quickly. That's why Rasa Sindhura is mostly important. So Shodhana, then Shamana medicines, now the external treatments and which are complementary for relief and cosmetic regression. Now you can use them for the symptomatic relief or cosmetic relief. Haridra Tail, that is turmeric in coconut oil, that is acidic to restore skin pH imbalance. Amla Dharmi, now when you have a history of Gover Kanjanya, that is measles and chicken pox, if you have history in patients, or Kamala, and you feel that there is a accumulation of the Ksharadharmi Ushnata in that patients, which has leads to this psoriasis condition, which can be considered as a causative factor, causative background of the disease. Haridra Tail is the recommended drug for external application. The Chaturthak Tail, that is this internally and externally. Kiratikta Amruta Chandanam Vishwabeshajam. It stimulates Bhrajak Pitta, clears subdermal channels, and helps in shading hyperkeratotic layers and reduce inflammation. So Haridra Tel and Chaturthak Tel are the important external medicines we use in Panchabhotik Chikitsa. Now prognosis. When patient come to us, he asks for prognosis. Sir, कितने दिन में ठीक होगा? How much time I will require to take your medicines? Every patient comes to us and asks this question. So for this prognosis concept, that I have, is if easier to treat, if you can find that the psoriasis is mainly confined to Rasa Rakta or mouse, or eruptions in Akash dominant side, that is head and neck, it is easier to treat. Difficult to treat, that is involvement of Prithvi up regions like below umbilicus, Kapha Pitta or Vata Pitta dominance, it is difficult to treat. The crucial factor is the cases where the specific cause and path of development are clearly determined. That is, if you can draw the Samprapti correctly, if you can find the cause and its pathway, that is Samprapti, if you can able to understand the Samprapti in the right way, it is very much easy to treat. That is a crucial factor. Pathya, apatya, what you can avoid? You can avoid green chilies, raw garlic, onion, sprouts, curd, fermented food, milk with fruit and salt. So advise simple diet, moong dal, rice, fruit, vegetables, fresh sweet buttermilk. In lifestyle changes, avoid excessive soaps, maintain regular meal sleep timings, manage stress with dhyan and asanas. So you should always go for it. Now I will discuss some clinical cases. When one patient came to me, with the 8-year-old girl with a scalp psoriasis for 1 year. Her mother actually complained of severe dandruff. First, they thought that it is a dandruff, and that's why they use many, the hair oils which are available in the market. They tried to use, and but the dandruff was not going. So when they came, that is then I found that it is a scalp kind of psoriasis. The history of contradicted diets and jaundice was found. I used Takradhara with good effects in this case, and internal medicines included Jwarhari Yog, Palatrikadi Gugul, Shvadanstadi Gugul, Jingi Sharadi, and Chaturthak Yog. The girl was totally cured in 6 months. That is it. So, if the disease is new, if it is confined to one place, then the chances of cure they increase. Incompatible diet. A male patient of 30 years came with psoriatic lesions almost all over the body. He gave history of contradicted diet, viruddhahar, and special emphasis on non-vegetarian. Non-veg बहुत खाता था. He has a marketing job and frequently exposes his skin to sunlight and shadow. Marketing में जिसको हम व्यत्यास बोलते हैं, वो व्यत्यास उसको था, यानी कि वो धूप में से छाव में जाएगा, छाव में से फिर से 2 मिनट के बाद धूप में आएगा. That is a व्यत्यास. And he complained of constipation, nocturnal urination, indigestion, and disturbed sleep. The drugs used include Chaturthak oil externally, Arogyavardhini, Haradu, Patoladi Yog, Jingi Sharadi, Khadira Rishta, and Jwarhari Yog internally. In purification procedures, Virachan and Vamana were done. So these kind of patients with, when we can find the causative backgrounds, we can treat them very nicely. Psoriasis after hysterectomy. See, the lady patient of age 51 came with psoriatic lesions on both knees for 2 last years. She had hysterectomy at the age of 38 years because of multiple uterine fibroids. Uterus is a prime organ in females, and its surgical removal should be avoided as far as possible. That we know, but many times the patient has to go for the surgical things. Uterus is a prime organ in female, and in surgical removal should be avoided. It plays a big role in metabolism and purification of blood in females. It is a Prithvi Mahabhuta dominant organ. Considering the above factors, management was done. Internally, she received Kanti Prabha, that is Chandra Prabha and Padma Kashta, Mahamanjishtadi Kwatha, Patoladi Gugul, and Kukutnaki Gugul. Though Kukutnaki Gugul is useful in fibroids and any Granthi, Arbuda kind of things. But if you go for, if there are no active fibroids right now, still due to the hetu, I gave her Kukutnaki Gugul, and Chaturthaka oil was used externally. So such kind of cases we can see. Now, psoriasis management requires a holistic approach addressing the Agni Samstha. So you should always look for the management of Agni, consider the Agni and its use. Panchavatik Chikitsa offers a unique methodology to break pathogenesis by balancing Mahabhuta properties. Patient compliance and long-term treatment are essential for sustained results and preventing relapse. So the help and the cooperation of patient is very much important in the results of Panchabhotik Chikitsa. Sorry, the psoriasis Chikitsa. Now, to conclude, recently I have published one book, that is Panchabhotik Aushadhi Shlokavali book. One medicine, one shlok I have given with trilingual clarity. That is, meanings are provided in English, Hindi, and Marathi. So anybody can read this book. All the formulations which we use in Panchabhotik Chikitsa, the shlokas of that formulations were not available. So I have constructed the shlokas and published this. Like what is inside, that is 41 carefully selected medicines organized into sections like Churna, Gugul, Kalpa, and everything. And like this, this Hallu, we use most of the patients in Hardu. That is the shloka of Hardu we have constructed, and the trilingual translation is also there. So for more information on Panchabhotik Chikitsa, you can visit our Sanstha website datarpanchabhotik.org. You can order Panchabhotik books and medicines online. We conduct 2 courses, one on Panchabhotik Chikitsa and other is on Vedic nutrition. So both the courses are online. They are accredited with Rashtriya Vidyapit and Ayurveda Accreditation Board, Ministry of Ayush. So you can learn more about this Panchabhotik Chikitsa also. So before I conclude, I once again thank Dr. Ramdas and his team, and for inviting me and providing me with the opportunity to present with you my few thoughts, my clinical experience in treating the psoriasis. So once again, I thank you, the organizers and the audience, for their silent patient hearing. Thank you very much.
Thank you very much, sir. Thank you very much, Honorable Vaidya Aniruddha Kulkarni, sir, for such a wonderful, insightful, and clinical enriching lecture. Your guidance on Panchabhotik approach, supported by the clinical case discussions, has provided a clear clinical direction for managing the psoriasis in day-to-day practice. We are grateful, thankful, sir, for sharing your valuable knowledge and experience with us. On behalf of MAASD, I respectfully request our founder, President Dr. Ramdas Garze, sir, to present a virtual memento to our esteemed speaker, Honorable Vaidya Aniruddha Kulkarni, sir.
Ma'am, some questions?
Yes. You can type your questions in the chat box along with the name. We will shortly take it. A digital felicitation symbolizes our deep appreciation for your outstanding academic contribution and continued guidance to the Ayurvedic fraternity. Thank you so much, Honorable Aniruddha Kulkarni, sir.
Thank you
for your guidance.
Thank you.
So we will take a few questions.
Yes.
So I will just read out the first question. Dr. Nitin Patil sir has asked, if you want, you can put your camera on and video, audio, unmute yourself also. He has asked how long we can continue Arogya Vardhini as Rakta Pachak.
Now, for Arogya Vardhini should be you can continue Arogya Vardhini for at least 3 months. What I do is, for 3 months you can continuously give, though the granthas refer that it should be given for 42 days, but the pathology or Samprapti of Kushtha is so deep that in 42 days, so many few patients will respond. So yes, you can use for at least 3 months, and then you can discontinue it for another 15-20 days, and again you can start.
Thank you, sir. The next question has been asked by Ashish Sharma. He is asking when to stop Chaturthak Yoga.
Now, in Ayurveda, there is always the questions regarding which drugs to use and when to stop the use of that drug, or when to change our treatment. Now, that is the most important part of the treatment, and which many of us struggle to understand and decide also. The simple answer is that when you start any drug, you should keep in mind, or you should always decide why you are using this drug in this patient. What you want to achieve by using these drugs. If you want that, and in case of Chaturthak especially, when I use Chaturthak, I will only use it to reduce the kledha or reduce the hyperkeratosis, that is the formation of the layers of in the psoriasis. So while the patient come to us for the follow-up, you can ask him and see what our drugs are doing with that patient, and the drug which we have given with some kind of thinking, is that thinking is working or not, and that's way you can decide when to stop and when to start any drug.
Thank you, sir. We'll take another question. Dr. Sabahat has asked you what Dhatu Poshan Yoga should be given once the complete treatment of psoriasis is done to avoid its recurrences.
Yes, the main rasayan for the psoriasis is the main rasa, rakta, mausa, med. So these four major dhatus are affected in psoriasis. So to prevent its relapse, main things we can give is, the first we go for the rasa rakta, that is mainly vidrum kitta, that is praval bhasma and mandur bhasma for rasa rakta. And in case of mausa, we should go for triphala or shatavari. Triphala can be used because it is a multi-pronged drugs. You can use it in multiple conditions with multiple anupan, praman, and concepts. So triphala is a wonderful rasayan when used mindfully. So vidrum kitta and triphala, shatavari, these can be done. Other thing is that to avoid the relapse, we should educate the patient and ask him to completely refrain from the Nidana Sevana.
Thank you, sir. We'll take one more question. Arundhati is asking if Shardharmya Vyadhi has been developed in Amla Dharmya Prakriti. How to give, can we proceed with Amla Dharmya medicine? I'll repeat once again.
Yes.
Shardharmya Vyadhi is there.
Yes, I got it. Yes, she's asking that if the constitution of the patient is Ksharadharmi, and the Prakriti, the constitution is Ksharadharmi, and the disease she is getting is Amladharmi, what to do, or can we give the Ksharadharmi treatment? Yes, surely. You have to counter counter the treatment. That is, in the disease is Amladharmi, you have to give Ksharadharmi treatment. But if the constitution of the patient is Ksharadharmi, you have to be more watchful and ask the patient. You can make aware the patient that you should revisit me, or you can educate the patient that if you start to getting some 1, 2, 3 concepts complaints, you just tell me and then we will see. So yes, but under consideration and under physician's guidance, yes, Ksharadharmi drugs can be given to Amladharmi disease, though the prakriti of the patient is Ksharadharmi. Sure.
Dr. Danish, we'll go to the next question. Dr. Danish is asking, can you please share more light upon Rasa Sindoor use in psoriasis?
Yes. No. Actually, Rasa Sindoor is. I have not mentioned that Rasa Sindoor is useful in psoriasis. Yes, Rasa Sindoor. Why it is added to Tribhuvan Kirti? Because it is a Kupipakva Rasayan, which is prepared from the para and gandhak, the para, mercury and sulfur. So it is with intense heat. If you have known how to prepare Kupipakva Rasayan, it is the intense heat is there. The Mandagni, Deepagni, Madhyamagni, Tivragni we do, and that's why it is very much like a Akashiya drug, Vayuviya Akashiya drug. It is more like a Vyavayi Vikasi drug. So the main part, that is the Vishakari Ghataka, which are produced due to Viruddhahar, and which are the basic cause of all the skin diseases, the Dushi Visha or Garabhisha, we say Garabhisha. So for its elimination or digestion, the Tribhuvan Kirti is used, and Rasa Sindoor is used, or it is mainly used as a vehicle. It takes you fastly to that toxic elimination. So Rasa Sindoor वो आपकी गति को पास करता है, वो जल्दी आपको विष का पाचन करने में मदद करता है.
So there is one more question. Dr. Balaji is asking, नाद परीक्षा नुसार कशी चिकित्सा करावी psoriasis मध्ये?
No, you नाद परीक्षा के अनुसार आपको अगर ट्रीटमेंट करनी है तो उसमें मतलब आपको पढ़ना पड़ेगा. लेकिन यस, वो बहुत सारे जो नाद होते हैं उसके अनुसार हम कुछ ड्रग्स और ट्रीटमेंट्स भी हम कर सकते हैं. लाइक अगर बुद्धि के नाद होते हैं यकृत के ऊपर, तो जटामांसी या सारस्वतारिष्टि यू कैन गिव. इफ यू फाइंड द घननाद, that is dull notes on spleen with the history of excessive traveling, the drug of choice is Varanga Kakshar. If you can find the dull notes on hepatic region, यकृत के ऊपर आपको घननाद मिल रहे हैं, तो और कामला का इतिहास मिल रहा है, तो फलत्रिकादि is the drug of choice. So there are so many drugs you can start using by examining NAD also.
So we'll take the next question. Dr. Anjali is asking about Takradhara in psoriasis. Should be Siddha or added with some medicines specifically?
No, it's a no medicines should be added. But if you go for this Sahasra Yogam or Kerala tradition, you will find the Takradhara, and yes, you can use a Siddha Takra also. Sometimes you can use the Jatamansi, the Nagarmutha, that is Musta, which are the Tikta Rasatmak some kind of drugs, or Jatamansi, Brahmi, Shankhapushpi, because it is on the head region, which is a Akash region, and according to causes, कारण और हेतु सबसे इम्पोर्टेंट है. सो अंडरस्टैंडिंग द कॉजेस, हेतु, और उसके अनुसार ड्रग्स को चूज करना, ये हमारा मेजर काम है. ये हम जितना अच्छा करेंगे ना, उतना हम जितना अच्छा हेतु को पकड़ पाएंगे, हेतु को निश्चित कर पाएंगे, उतना हम अच्छी चिकित्सा कर सकते हैं.
Thank you, sir. We'll take one more question. Nitin Patil sir is asking birth date Aniruddha. How we can correlate with Shar and Amla Prakriti?
Yes. What it is written that this Amla and Shar Dharmi Prakriti, that is the main concept of Panchabhautik Amla Shar Prakriti is that in the conception, that is in the fetal development, the second month of conception, where Rakta Dhatu will be formed, what kind of external environment is there. Now, when it is Amla, that is mainly rainy season, the person will be of Amla Dharmi Prakriti. When it is a Kshar, that is the Grishma Rutu or intense heat, that the person will be of Kshar Dharmi Prakriti. So Amla, Kshar and Ubhay Dharmi Prakriti that we can get.
So we'll have one more question. Dr. Atul is asking if a patient is already having Amvat along with psoriasis, how we can deal with it?
Yes. Actually, psoriasis is a very big topic, and many times psoriasis is associated with arthritis also. It is psoriatic arthritic patients are also, you will get many patients with psoriatic arthritis. So yes, Amvat and psoriasis both have mostly the base of Am, the base of vitiated Prithvi and Ap Mahabhutas. So Pachana and Nishkasana, elimination therapies, Dipan, Pachan, Shodhan, Nishkashan, these therapies, they will work.
Thank you, sir. Sir, there are continuously too many questions. Can we take a few more questions?
Yes, you can take, but I think only 5 minutes.
There is one more question from Vishwajit. He is asking how to use Rasamanikya in psoriasis.
Rasamanikya is a drug which is mostly useful when there is oozing, there is a srav. So sometimes I use Rasamanikya, but it is mostly when there is a srav, there is a secretions, the patches are wet, there is something oozing, then Rasamanikya is useful.
So we'll take the last question. How long we can use the Rasarakta Pachak Yog, and how we can confirm about complete Pachan?
Yes. Now, you cannot completely understand how the Pachan is completed or not, or Rasa Pachak is completed or not. There are 2-3 guidelines I can give you, which we should use judiciously with our experience and knowledge. That when we say that when any disease, there the dosha dusha samurchana is there, and some dosha is there, some dusha is there, then only Vyadhi can develop. So the main part of the dusha vikruti, that is, the Rasarakta Pachak yogas, when they are given, they are basically the yogas which are guiding us, which are indicating us that this dhatu poshana, this dhatu pachana is afflicted by the ama. And mostly, see, the dhatu pachak yogas, they are described in Vishama Jwara. Yes, the Vishama Jwara. And in Vishama Jwara, the doshas, the ama and dosha, which are, they entering with the specific dhatus and residing there and creating Vishama Jwara, you can use for the deepana pachana of that particular dosha, ama residing in that dhatu. So what we can do is, you go for the Charak Sutrasthan 28, Dhatu Pradoshaja Vikar, you see the Dhatu Pradoshaja Vikar. And in all, there are Rasa, Rakta, Mouse, all Dhatu Pradoshaja Vikar are there. And then there you will find that which Dhatu Pradoshaja Vikaras are mostly related or associated with Am in them. And then you can classify them, and there in those dhatu pradoshaj vikaras, these dhatu pachaks, they work wonderfully. That if see the rasa pradoshaj vikaras, for palitya you cannot use any dhatu pachak. It will not be useful. But for jwara, yes, it is useful. So for aruchi, it is useful, dhatu pachak yogas. Like, so yeah, this kind of ama dosha complex, ama dosha and dhatu complex, where you see the dhatu pachak should be used, and it should be used until the am pachan is done. Now another indicator of am pachana is, another indication of the am pachana is that the definition of am, Sroto Rodha Balabhramsha Gaurava Nila Mudata Alasya Apakti Nishtiva Malasanga Aruchi Klama. So this is a generalized symptoms of am. So whenever you are treating any am condition, you should always keep these 10 symptoms in front of you and see whether they are improving or not. And if they are not improving, you can do the am pachana in that patient. Unless and until Srotorod is gone, Malasanga is gone, Aruchi is gone, that is they are the basic guidelines, the generalized am lakshana and dhatu pradoshaj vikar, which are classified under the am vyadhis.
Thank you, sir. I will respectfully request our founder president, Dr. Ramdas Garje sir, to present a virtual memento to our esteemed speaker, Vaidya Aniruddha Kulkarni sir, as a token of gratitude and honor. This digital felicitation symbolizes a deep appreciation for your understanding, for your outstanding academic work in Ayurvedic, and continued your guidance towards our Ayurvedic fraternity. We request all the people who has dropped down the questions in the chat box will definitely get coordinated with the MAASD coordinators and definitely get an answers to it. We like to encourage all participants to take active membership of MAASD and stay connected with our ongoing CME activities, academic updates, and professional opportunities. We encourage all the participants to be also a MAASD members. I will also like to inform you, as we complete successfully the 99 CME of MAASD, further moving ahead, we are going to do a century, that is 100 CME on 15th of February with none other than a renowned speaker, again Vaidya Ramdas Award sir. The topic for the CME will be the pain management through Panchakarma. The topic will be held and all the details will be displayed to you shortly. I request you all to do the registration as soon as possible. To formally conclude today's program, I invite Vaidya Dr. Nitin Patil Sir, Coordinator of MAASD, to present the vote of thanks.
Thank you, ma'am. Good evening, everyone. On behalf of MAASD, I, Vaidya Nitin Patil, Central Organizer MAASD, take this opportunity to express my sincere gratitude to all who have contributed to the grand success of MAASD 99 CME on psoriasis. First and foremost, I extend my heartfelt thanks to our speaker, Vaidya Aniruddha Kulkarni sir, who delivered such a knowledgeable, clinically relevant, and practically lecture on psoriasis. Your depth of knowledge and experience has truly enriched all participants and their benefits in their Ayurvedic practice. I would like to convey my deep respect and gratitude to Dr. Ramdas Garje, founder, president, MAASD, whose vision and leadership continue to inspire us. My sincere thanks to Dr. Sujit Dundre sir, secretary, for his constant guidance and support in organizing academic activities. I also acknowledge the dedicated efforts of the MAASD Central Council, Dr. Hitendra Badane sir, treasurer, and Dr. Ganesh Padai sir, whose teamwork and commitment made with this CME possible. Special thank to Dr. Seema Garje ma'am, convener, for especially effectively coordinating and managing this entire program. I sincerely appreciate Dr. Rashmi Doifude ma'am, who is MAASD Thane city organizer, to conduct this program smoothly and professionally as the moderator. I would like to thank Dr. Harshal Kutalkar, MAASD PG organizer, Navi Mumbai, for his sincere work. My appreciation also goes to Dr. Ambika Shukla ma'am, also Dr. Abhilasha Parade ma'am, also Sharvari Deshinge ma'am, for his sharing important information and his dedicated work with MAASD, and also Dr. Tejal Ipalgaonkar for his speaker introduction. Last but not least, I extend my sincere thanks to all participants who join us from across the India. Your active participation, interaction, and enthusiasm are the true strength of MAASD. We look forward to your continued support and participation in future MAASD academic and professional initiatives. Thanks you all. Thanks once again. Jai MAASD, Jai Ayurveda.
Thank you, Dr. Nitin Patil sir. We request all the participants to complete the MAASD registration at the earliest and follow the MAASD on Facebook, Instagram, WhatsApp for regular updates. Thank you all for attending this today's CME. Stay connected, stay updated, and stay academically active with MAASD. Thank you so much.